It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on our show, we're going to hear how Darla was able to correct painful varicose veins with help from vein specialist Dr. Peter Morgan.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point, you know, exactly what he could do for me, and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
Sunflower seeds can help protect your heart. Consuming a quarter cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fights infections.
Well, my goal is to give people what they want as much as I can, and usually I can do that. I pretty much have been blessed where there's not very many people that say, I can't help you. In fact, I can't really think of anybody. We try to give them a great smile. We do a lot of things that other dentists have told them, well, no, you know, I can't do anything to help you. And I've actually had dentists who refer patients to me, so I'm very honored by that. We try not to just go in and, you know, just do it a cookie cutter type, one size fits all. You know, I try to individualize it for the teeth because I want to be as conservative as I can. I want to do it as comfortably as I can for people, minimal invasion on their tooth structure that's in good shape. So I'm not just trying to talk everybody into doing veneers or doing crowns or whatever. I mean, some people come and want that, and that's fine, but I try to give them options. I try to say, yeah, that is an option, but here's another option, and this might be better for you because ABC. And so we try to work with them and work within their budget and what they can do and what they want to do. What I love about what I do is how it changes people's lives, especially someone who was unhappy with something that had done earlier that came here to get it fixed. Because they're more desperate sometimes than the people who had had anything done. They're disappointed, they're hurt, they were wanting something and they didn't get it. And to be able to take someone like that and to show them it's okay, it can be fixed, it can look fantastic, and to take them and to guide them through that and help them achieve what they wanted to achieve originally and fix it for them is really satisfying. It really makes you feel good about what you're trying to do. I had one guy in with his wife, it's like she won't shut up about her teeth, you know, and she's talking to everybody about it. And so I love that. And, you know, getting Facebook posts from patients and talking about how I love my dentist and things like that. I mean, that's awesome. There's a lot of satisfaction in that, and I really enjoy that.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. For more information and to even request an appointment with one of the amazing doctors that you see on our show today, just head to our website, bestdocsnetwork.com. Head to the doctor's profile page and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's General Surgeon Dr. Cliff Thomas, who's going to educate us on treating acid reflux.
I'm studying music education and I'm studying opera. I have voice lessons twice a week. I have choir rehearsals every day. I have opera rehearsals all the time. And so I have to be in tip-top shape. And before this surgery, if I sang for more than 30 minutes, I was done.
So some people wonder what GERD is. What's going on is the esophagus is tube that goes from the back of the tongue down to the stomach. And at the bottom of the esophagus where it connects the stomach, there's a one-way valve that should let food and juice into your stomach but not let it back up into the esophagus. When it goes back up into the esophagus, it can burn the esophagus and then cause the symptoms like heartburn and coughing, asthma, a lot of symptoms.
Acid reflux all day, every day. I mean, I would eat, acid reflux. I would not eat, acid reflux. Have a drink of water, and so it was one of those things. I would wake up in the morning with a sore throat. It would affect my singing, like I said.
So I've been doing surgery laparoscopically for 22 years for reflux and have excellent results. And what we do is an outpatient procedure. Through very small incisions, we go in there and we reduce the hiatal hernia. So that's basically where there's a little gap in the diaphragm and the stomach's protruding up into the chest. So we pull that down and close that gap in the diaphragm and rebuild that one-way valve. The operation takes less than an hour. People usually go home an hour after surgery. They're usually doing everything within a week. And they're usually getting out of the house in 1 to 2 days after surgery.
Actually, I told Dr. Thomas the results of this have been amazing. The very, very first morning after my surgery, I woke up and I almost started crying, literally, because it was the first time in my entire life that I had woken up without a sore throat. One
of the more common things people tell me after surgery is this is one of the best things they've ever done in their entire life. So this heartburn symptoms kind of is in the background of their daily life, and it may not seem like the worst part of any one day, but when it goes away, their quality of life improves so much and they don't have to live with it, they're kind of ecstatic.
It's been an amazing, amazing improvement in my entire life, and it's something that I'm so, so grateful to have had done.
Did you know that blueberries can help improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells. To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
You hear a lot about ADD in adults nowadays. A lot of people think they have it, but let me help you understand this a little bit. If you walk into a room and you can't remember why you're there, or you're having trouble getting everything done, that doesn't mean you have ADD. That means you're just kind of a normal human being. ADD is really a pretty pronounced symptom and syndrome in an adult. For example, you may be doing something at home on a scrapbook for the kids and you hear a bus go by outside or a truck go by and you lose your total focus and can't get back into it. That's sort of like ADD. Or you hear a phone ring down the hall at work and you lose your concentration on your computer screen. There are tests for ADD and there's great drugs for ADD. Here's the problem. ADD drugs, they're sort of like a form of speed. They're going to make anybody feel better. They're going to make you think quicker, have more energy, get more done. But if you don't have ADD, all you're doing is taking a drug that's speeding you up and it's really not good for your heart. So you really need to be tested to be sure you have ADD.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
We have young people who are already having thickening of their heart muscle. They're already not quite having normal function. And it's the earliest signs that there's a problem there, that the heart's working against a large extra load that it normally wouldn't have to.
When I originally started to even look into this after I talked to my friend, I was probably between 335 and 340. I'd been that for 10 or 15 years, been over 300 pounds for at least 15 or 20 years.
We're giving them back some of that control in that one area where they've had a problem. But it's a dangerous area. I mean, you can't walk around at 310 pounds and think everything's going to be okay for very long. It's not.
There's been times when I'd lost weight before. I've got down to 225 before, but 6 months later I'm back at 300, and that was always my issue. And after you do that 2 or 3 times, you know, why do you want to do it again? Because you know what's going to happen. I actually had a buddy of mine that did the surgery probably a year before I started looking into it, and he had great results. His weight loss was incredible from what I'd seen, and I'd known the guy for several years. And he was completely happy and excited with everything. So that's when I started looking into the surgery myself.
Buck has lost 115 pounds in about 6 months after having a sleeve gastrectomy. So I mean, that's a good outcome so far. We're only partway through. We're going to expect more weight loss beyond that, although he's clearly getting down towards his ideal body weight, which is where we'd really ideally like to have him.
I started off at 335 or 340, January of 2011, and it's February of 2012, and I'm at 186. It's like being reborn. Before, I guess I just kind of muddled through life. No excitement, just do what I had to do to get by, no energy, no fun. Now, I mean, the excitement, fun, romance, social life, things that I didn't have before. You changed my life. It's a whole new world, every day.
University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing. For more information and to watch hundreds of our videos on our amazing doctors, head to our website. It's bestdocsnetwork.com. Now we move on to our next story to see Alondra overcome chronic sinus infections with help from head and neck surgeon Dr. C.T. Nguyen.
I was experiencing a sinus, like an ongoing sinus infection for like the past 2 years. I was feeling congestion in my nose and ears and throat, fever, body aches, headache.
Alondra can't breathe through her nose. She feels pressure in her face, her ears, and most importantly, she had this constant post-nasal drip that make her cough all the time.
Constant feeling like you're tired, you know, you're feeling like you got to go to work, but you feel not 100%. And it would also affect my social life because I was always so tired out of feeling sick that I would just decide to just stay in and not really go out.
Upon examination, I noticed that her nasal cavity and sinus are completely blocked. She can't breathe through her nose, and decided upon a plan of treatment that consists obviously of allergy avoidance and allergy control combined with a turbinate coblation. It's a technology using radio frequency to reduce the swelling on the side wall of her nose, increasing her capacity to breathe through her nose and improving her nasal allergy symptoms.
After the procedure, I no longer experienced the symptoms that I was experiencing before. I noticed that I could breathe a lot better, like I just want to say I could breathe.
Alondra was very happy with the result of the treatment. We actually found the cause of the problem and targeted our treatment. Alondra breathed better, she feels better, it's a new person. Medicine has advanced so much that there's always a solution to breathe well and live well. Patient doesn't have to suffer anymore.
I no longer felt congestion. I wasn't getting sick every month because I no longer had that infection inside of like my sinus passages. So I want to say I feel great now.
Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Ina Yashova came to my office complaining of fungal toenails. Very common thing, especially, you see it in summertime, it's very prevalent. It's a fungal infection of the nails are discolored, and she wanted them treated.
I keep my body in shape, and I want to be healthy, and I want to have, everything perfect. So it's one of the things when I found out that something is wrong, I couldn't go for some time because I was busy, but I told to myself, no, I have to.
It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because probably most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life.
I figured out that I have good results because when I could see my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail.
The risk of a fungal infection is not just the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because that's an infection, and that requires a surgical procedure.
I got new nail bed, new nail, and it was like pretty healthy.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
One way to treat or overcome breast cancer is by having a mastectomy. Up next, we're going to see how Roz was able to reconstruct her breasts after her double mastectomy with help from plastic surgeon Dr. David Altamira.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body, and she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get what would you say, a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, I wanted to get back to me. I got my sexy back.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day. BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Jose has a question for Dr. Cliff Thomas. What are the side effects of acid reflux medication?
So the side effects from taking reflux medication that concerns people the most these days is osteoporosis. So there was a study that came out that suggested that people have increased risk. Now I'm not 100% convinced that's true, but nevertheless people are very concerned about that. And now there's a box warning saying that this is only FDA approved for 8 weeks of treatment, and very few people take it for 8 weeks. So it's really kind of the cat's been let out of the box that maybe taking this stuff long term is not a good idea. And the truth of it is the medications don't fix the problem. They can fix the problem of the juices eating away at your esophagus. They're pretty good at that, but they don't fix reflux, and they don't fix your risk of cancer of the esophagus.
I noticed something wrong in July of 2008. I actually went to a routine doctor's visit for some breakout that I had, because I had used a different type of deodorant. And when they took my blood pressure, they said that it was, unusually high.
Hypertension, what can it cause? And some people think, well, their blood pressure is a little bit high, they can take a medicine, or maybe they just don't have to take it every day. A lot of people take this idea of hypertension kind of casually, but we shouldn't, because high blood pressure can cause problems from stroke to heart attack to kidney failure. So many things can be caused by that one word, hypertension.
Ended up inevitably going to the emergency room like a couple of days after, because I just started feeling really dizzy, headache. It was as if my heart was actually hurting inside of my body. The blood pressure was 200 over 110. When I came to see her, her first words were, "We're going to heal you." And I was like, yes, came to the right place.
She has been committed and faithful to take her medicines and to take care of her body to protect her heart. Because high blood pressure can lead to many other things, especially cardiomyopathies or weakening of the heart, heart failure from diastolic heart failure or systolic heart failure. So we have prevented that in her, and she's doing very well.
Before, I would feel sluggish, tired, anxious a lot, and a little headaches like that. And then after, once we started treatment on medicine, different medicines, I would feel better. I would feel like I had energy. I just felt better and good about myself.
If the pressure is too high, too much damage can occur in the organs. We have to take it seriously, and we just need to educate patients, I believe. If patients really knew what it was all about, they would come and get checked and take their medicine.
I believe that Dr. Varughese has been blessed from the Lord with life and favor, in her hands. So, and I just love that about her.
What a great show today. And that's going to wrap up another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are making a difference in people's lives. If you have a question, a comment, or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thank you for tuning in, and I'll see you next week.